Hi, I'm Dan Fazio with Vetrepreneur, and today we're talking to Dr. Eugene Skourtes, an Army veteran and dentist who built a wildly successful dental group that today has 46 offices in 3 states. Thanks for joining us today, Doctor.
Well, you're welcome.
We love talking to veterans who have built successful businesses, and you certainly meet that definition. You're president and CEO of a company that you've built from one office to a group today with 46 offices in Oregon, Washington, and Idaho. You employ 141 dentists and a total of 1,236 employees who treat over 440,000 patients. That's amazing. That's success. Congratulations on that.
Well, thank you.
But so let's take it from the beginning. Obviously, that didn't happen overnight. What was your original field of study as an undergraduate at the University of Oregon?
Well, both of my parents died of cancer when I was young, and so I wanted to be a physician. So I was basically a biology major at the University of Oregon, and I tried twice to get into medical school, and I didn't get in, and I was now working on my master's degree in biology. The dental school at that time was called the University of Oregon Dental School. It's OHSU today. And they were recruiting dentists. And after I spoke with them, they told me, well, with your credentials, you're in. And I thought, what do you mean I'm in? Well, to make a long story short, um, they, after a few weeks, sent me a letter saying that I was just accepted to dental school and I would start in the fall of 1964. And that's how I became a dentist.
Wow, that's great. So a really good plan B for sure.
Right.
Yeah. So did you volunteer for the Army or did you get drafted? This is during the Vietnam era.
Well, I actually volunteered. And what happened, as I mentioned earlier, after I got into dental school, I told myself, I'm going to quit school, work, and I can be ready in September when the dental school started. Well, as you know, during the Vietnam period, if you were in school, that was deferment. And because I wasn't, I got a notice to go before the draft board. And I basically showed them my letter of acceptance to dental school. And I told them, wouldn't you rather have me as a dentist than an infantryman? And fortunately, they said yes. So when I graduated, I felt I made a commitment and I volunteered to go into the Army.
Okay. Well, I guess that's definitely preferable to be a dentist than an infantryman in Vietnam's. Uh, so you served as a dentist in the Army for 2 years. What was that like?
Well, I really enjoyed it. I was stationed in Lynn Hill Farms, Virginia. It was considered a remote area. And so not only did I treat infantrymen and what have you, but also dependents. So children, mothers, fathers, grandparents, whomever. And because we were fairly small, there were only 4 dentists stationed there. So it was easy to develop a relationship with the other dentists and even the physicians that were there in the infirmary. So I really felt I had a great experience in the military.
Yeah, it sounds like it. So when you got out of the Army in 1968, what was your plan?
Well, I didn't really have a plan. I wasn't sure what I wanted to do. I left the military because my wife, we had 2 young babies, and she wanted to come back home. Like I said, I didn't really know what I was going to do. So I went to the dental school, which is in Portland, Oregon. That's my home. And I met a dentist there who had just sold a capitated dental plan. And I met with him. He needed an associate. Um, I didn't know what a capitated dental plan was. I was familiar with fee for service. You do a procedure, you get paid. A capitated is you get a monthly premium. And when I heard that, I thought, wow, what a great way to practice to make patients healthy and get paid for it. And that's basically how the whole thing started.
Uh, I didn't know what a capitated plan was either until just now. So thank you for educating me. So you opened your first office in 1970 in Portland. You had 3 employees. Did that include you?
Uh, it would be 4 if it included me.
Okay. So modest beginning. How long was it before you opened your second office?
It was around 8 years.
8 years. Okay. And then why did you open a second office? What need did you see there that
Well, we got a relationship with Blue Cross, an insurance company, and they started selling our plan. And so Portland has a river, there's an east side, west side. We started on the west side, so we opened a second office on the east side, basically for patient convenience.
okay, that makes sense. Well, as your company grew, how did you balance being a dentist with being a business owner who was scaling the company?
Wait, what was the question again?
As your business grew, how did you balance being a business owner,
Uh,
scaling a company, and being a dentist?
well, I've always practiced. In the later years, I only was practicing one day every other week because I felt it was important to also be a dentist so that as the company grew, I know what was working and what wasn't working well in the clinical part. Obviously, I hired salespeople, CFO, and others to help me, but we always had the clinical emphasis. And I think that's why we were successful, because we never forgot that we were really a dental practice. Like you said earlier, a large one, but it was important to make sure that the clinical people felt supported, and I tried to do that, being basically playing 2 roles.
Yeah. Well, obviously you did it well because it worked. What else? Is there anything else that you would attribute the steady growth of the dental group to? Any secrets?
Well, well, it's interesting, because um, the military mission is to deter wars and protect the public. And our mission was to stop the disease repair cycle by evidence-based methods of prevention and treatment. And I'm not saying that the military mission guided me, but I realized after a while, yeah, we're not saving 100 million people, but we can save teeth by practicing our model.
Yeah, that's great. Great philosophy. Well, speaking of the military and how you applied it to your civilian career, what did you learn from the military, from your 2 years in the Army, that you were able to apply to your career as a dentist and also as a business owner?
Well, it taught me to be a leader. And like I mentioned earlier, I like the camaraderie. Um, like I mentioned earlier, we were a small clinic, but I also learned from some of the dentists that had been longer in the military. It helped me, I think, become a better dentist. I learned how to extract teeth, difficult teeth, um, things that you don't really get in dental school. So when I left the military after 2 years, Not that you're ever at 100%, but I certainly felt that I was at 95% in knowing how to be a good clinical dentist.
Hmm. What advice would you give to veterans who are interested in owning their own business or perhaps already own a business but want to scale it?
Well, let's face this, it's tough. But the point is, if you have an ideal and if you really believe in it, don't give up. My biggest challenge was organized dentistry. I don't know, I think they felt threatened of the normal fee-for-service way dentists practice. You do a procedure, you get paid for it. I didn't think they liked the fact that we're getting paid to basically get keep patients healthy. So don't give up. If you believe in it, don't give up.
Yeah, that's great advice. Is there anything else that you'd like to add that we didn't talk about?
Uh, Not really.
Okay. Well, doctor, thank you so much for taking time out of your busy day, I'm sure, to share your story with us.
Well, thank you as well.
Take care.
Bye.